I'm Sandra Barrington, Executive Director of Sierra Nevada Memorial Hospital Foundation, and welcome to Doc Talk. This is a series where we bring local physicians to you so you can learn a little bit more about their background, how they got to where they are in their career, maybe a little bit about what they think the future of healthcare looks like in our rural community. And today I have one of the residents training in our family practice residency program, Dr. Karli Haugen.
Hello. Hi.
Welcome. Thank you for joining us today.
Thank you for having me.
We're so excited. Yeah. So we've started a residency program several years ago. And what year are you in your program?
I am a second year, so
Okay.
which makes me the second class of residents.
Wonderful. Yes, we will have our first graduating class this year, which is very exciting. And thank you. I was saying earlier, thank you for taking a chance on a new program.
I'm really, really happy I matched here.
Oh, good. And the program is based out of Chappaday Indian Health, one of our continuity partners. And we also partner with Methodist Health, or Methodist Hospital of Sacramento. And thank you for being here today. So tell us a little bit about your educational background and what it takes to get to this point in your career.
Oh, initially it wasn't medicine. So I started out, my undergraduate studies were in development economics.
Oh, wow.
Within the international relations department. So at 17, that was my big passion. I was curious about things that didn't work and what the underlying cause might be, and I suspected at that time it might be economics.
Wow.
And so I loved my undergraduate studies and then went out into the world, taught some English because I wanted to get my Spanish down.
Mm-hmm.
Yeah. But in the meantime, I really had an unplanned experience. I ended up in Romania, in part because I wanted to check out this World Bank project that was going on out there, but also just because for visa reasons, was just trying to be somewhere for a summer. And I went to this emergency room where the World Bank had put some investment in to buy lots of helicopters.
Oh.
This idea was that they could serve a big stretch of the Transylvanian mountains with one ER if they had enough helicopters. And I was there in part from an economic standpoint, but just as an intern, you're in the room, you're in these spaces, encountering these people, and I was really struck by that experience. I had studied no sciences, but I liked people. And it felt like a lot of the really meaningful moments of folks' lives were happening in these medical spaces, and I wanted in. I had taken no science, so I had to go back and do some night school, and that took a bit, but then made my way to med school.
Wow.
And now I'm here. Yeah.
That is fascinating.
Yeah, it was a bit of a circuitous
That's such a great story.
Yeah.
I had no idea.
Yeah.
Oh my gosh.
It wasn't a straight line. But.
Yeah. Well, that's interesting because a lot of people, they're like, I'm going to be a doctor when I grow up, and they're just on that trajectory. But you got there from a place of just wanting to help people.
I thought it was going to be international law, but sometimes there's unexpected turns, and I'm really glad that I'm a doctor and not a lawyer.
Well, we are too. Glad that you're a doctor here in our community.
Thank you.
Yeah. So what does, in a residency program, what does a typical day look like for you?
Oh, there are no typical days. That's the really exciting thing about residency, but particularly family medicine residency. It's so broad. And in reality, 3 years is a short amount of time.
Goes fast.
To see everything. Yeah. So every 2 weeks, we're in a different department. We do have our continuity clinic patients every week at Chappaday, but much of the week we're in somewhere like the emergency room or delivering babies or in a pediatrics office, trying to see as much as we can. So,
wow. Do you have one rotation that has been your favorite so far?
That's a great question. I really enjoyed working in the urgent care up here in Grass Valley. I think that's been a fun, fast-paced environment. I think one of the more formative experiences would be actually from our intern year. We spent a lot of time in the ICU. And I think those are formative memories of seeing what patients and their families go through.
Yeah. Well, great. And so, choosing a rural program and choosing a rural community, where are you from originally?
I'm from Folsom.
You're from Folsom. Okay, so you're close to home.
Yeah, I'm nearby. Folsom of 30 years ago, though, it's
different.
It's a changing place. Yeah.
Same. I grew up in Granite Bay, and it was different then than it is now.
Yeah.
So, what made you choose a rural program over an urban program?
I wasn't specifically drawn by a region, and I didn't initially know that I wanted to do a rural training program. What I did know was that I wanted to work with patient populations who, for many reasons, might not have access to a robust system of specialists.
Okay.
I think because that was a lot of populations I'd worked with prior to starting a medicine path. So I had worked as a outreach coordinator in a very urban environment, actually with Wind Youth Services in Sacramento, working with transitional age youth who were able at times through the support of One Community Health were able to access a primary care doctor, but oftentimes there were a lot of barriers to seeing a specialist.
Yeah.
And you kind of see that pattern repeated in multiple spaces. So I knew as a med student, I wanted to be able to do as much as I could as the primary care doctor. And it took a while for me to realize that meant I wanted to be in a rural space. So I'm really, really grateful.
That's great.
That pieces fall together for that.
Great. Well, and a little bit about the future and maybe your thoughts on what you think family medicine looks like in the future for our community.
Oh, goodness. The future of family medicine seems uncertain right now. I think that's a hard thing.
Healthcare in general kind of feels uncertain, let's be honest.
I think there's a lot of unknown variables for family medicine right now. One of the big ones is encouraging folks to become family medicine doctors. It's a very rewarding field. It can be a demanding field. I think there's a hope that some of the new tools available to help us with charting and documentation so we can focus in on the patients more might be encouraging. But there's questions of insurance and funding and the distribution of resources, and it's hard to predict. I think one of the areas I think there is more certain direction, I'm interested in the palliative subspecialty. And that specialty seems to have a more clear trajectory. It's growing. I think it's going to continue to grow, which I think is an exciting and beautiful thing.
Yeah, and we have a great partnership at the hospital with Foothills Compassionate Care and their palliative care program, and they've really grown that. They started working specifically with cancer patients, and I think just kind of maybe breaking down the myths of what palliative care is versus what hospice care is. It's growing, so I'm glad to hear you say that.
Yeah,
that's wonderful.
Medicine is full of confusing language, and even sometimes living in that space and living in that profession, it can get confusing. So I'm glad there's more conversation out in the community about what doctors can do and cannot do for end-of-life care. So,
Well, thank you for joining us today.
Thank you.
Thanks. And you can find our Doc Talks on Nevada County Media or at supportsierranevada.org/doctalks. And we look forward to seeing you again.